THEMBI is not her real name, and she doesn't want to show her face because she's afraid she'll get into trouble for complaining. Reading this newspaper article has made her angry because it could explain why her newborn baby died. At least 10 babies have died in the same hospital in Tembisa Township in Johannesburg in the past 2 months. The government blames drug-resistant bacteria.
I think it's more than that. It's more than 10 babies. The Tembisa hospital is hiding information. Because if they're hiding information from us, like to what was happening with our babies, the only thing that we knew is that our babies are sick.
The cause of the infection isn't clear. Doctors say it can lead to pneumonia and meningitis. Some South Africans blame hospital overcrowding, understaffing and poor hygiene. Health department managers admit employing more nurses and doctors could help prevent more deaths, but there are other issues.
The problems that we're dealing with is issues relating to resistance to antibiotics. Because when we use antibiotics, we don't finish the course. We use antibiotics that are not prescribed or doctors prescribe antibiotics for any other reason. It leads to our bacteria not being able to respond to these antibiotics, which is a big problem.
Africa's most industrialized economy is struggling to provide affordable quality healthcare for the majority who are poor. In some neighborhoods, private clinics try to ease the burden if patients can afford to pay to avoid the long queues. But there aren't enough private clinics to substitute overstretched and ill-equipped state-run hospitals. The government wants to introduce a national health insurance scheme to try and close the gap between the rich and the poor. At the moment, only a privileged few receive world-class care at private hospitals, while millions of mainly poor black South Africans have to rely on understaffed and overcrowded public health facilities. The proposed insurance scheme bill still needs to be debated in Parliament. If it becomes law, the state will control how much private health facilities charge, making it more affordable for the poor. Tax rises will be needed to pay for the scheme, but some economists say the country's struggling economy can't afford it. The ruling African National Congress says universal health insurance is the solution, but the mothers who recently lost their babies say it's too late for them.
No, I don't see myself going back there, ever.
Haru, Mutasa, Jazeera.